Behavior resources for owners. You love your pet and want to make sure he is happy and healthy, but there are a lot of options out there. Sometimes it's hard to know what to do and who to turn to. Here are some things you should know. The first sign of illness in your pet is a change in behavior. If you think your pet is acting differently, see your veterinarian to make sure he is in good health. Changes in behavior that call for a visit to the veterinarian include a change in appetite, a change in water consumption, change in frequency of urinations or bowel movements, a change in activity, a sudden development or worsening of the concerning behavior, a change in temperament, including an increase in irritability or aggression. If your dog suddenly seems fearful or is hiding, wanting to be closer to you than normal. If your dog seems more sensitive to the environment, like noises, to other animals, or to people. If everything checks out okay medically, the changes in your pet's behavior may be associated with fear, anxiety, or stress. In this case, your veterinarian might recommend behavior treatment with a qualified animal behavior specialist. It is important to know that anyone can call themselves a trainer or behaviorist without any formal education. There is no special test that someone needs to pass to advertise that they have these skills. However, there are organizations that certify individuals that have met certain levels of education and experience. It is important to do your homework before trying to find behavior training for your pet. Bad advice can have lasting and devastating effects on your pet and you. The highest level of education possible is a board-certified veterinary behaviorist or diplomat of the American College of Veterinary Behaviorists. This is the equivalent of a psychiatrist in human medicine and would put the letters DACVB with their credentials. Board-certified veterinary behaviorists have the skills and knowledge to take detailed behavioral and medical histories and construct a treatment plan on the pertinent behavioral and medical information. For more information, visit www.dacvb.org. Certified Applied Animal Behaviorist, or CAAB, would be comparable to a psychologist. They come from a variety of backgrounds, but usually have a PhD degree in animal behavior. Some CAABs are also veterinarians. If they are not a veterinarian, they are expected to work closely with veterinarians to provide a total behavior healthcare team. For more information, visit www.animalbehaviorsociety.org. Some veterinarians have a special interest in behavior with varying levels of education, experience, and comfort with treating animal behavior disorders. Many of these veterinarians are members of the American Veterinary Society of Animal Behavior. For a list of members in your area, visit www.avsab.org. Many organizations have recognized individuals that have various levels of skill with animal training and knowledge of learning theory and application. These individuals would be comparable to a counselor. Often veterinarians and professional animal behaviorists team up with skilled, knowledgeable, and trusted trainers to provide you with a complete behavior healthcare team. This team approach provides you with the well-rounded care to address behavior concerns. If you are having troubles with typical cat and dog behaviors, like jumping on counters, jumping on people, difficulty walking on a loose leash, or not coming when called, know that there is help out there. A skilled and progressive animal trainer who uses fear-free training techniques can help you. Remember that this training should only start after a trip to your veterinarian, who will make sure your pet is physically healthy first. Here are some things to look for in an animal trainer. Professional animal trainers should use positive reinforcement with both owners and animals. They should show you ways to use the philosophy of positive reinforcement with your animals daily to help you accomplish the outcome you are looking for. Humane training methods should be promoted which protect the human-animal relationship and do no harm to the owner or animal. They should be certified members of a professional training organization. They should recognize the value of education and regularly go to educational seminars. Professional animal trainers build and maintain a respectful and professional relationship with veterinary professionals. They understand that veterinarians are the expert responsible for diagnosing behavioral disorders. They also understand that it is up to the veterinarian to diagnose medical conditions and to prescribe treatment plans that may include prescription medications for your pet. Because of many variables, such as genetics, temperament, and owner commitment and experience, an ethical professional animal trainer cannot and should not guarantee the results of the training. Importantly, the trainer should not recommend or use choke collars, pinch collars, electronic shock collars, or physical punishment. They should not use dominance hierarchy theory as a training philosophy, the idea that you as the owner must dominate the dog and use punishment as a training method. Finally, a desirable trainer should be professional and respectful to people and their pets at all times. If your pet has undesirable behavior, there is help out there. Talk to your fear-free veterinarian about your concerns and ask them for recommendations for trusted, humane trainers or behavior specialists.